All right, well, it is 1 minute past 2, and we have quite a few of your attendees here, so I want to say welcome. This is the Health and Care Research Wales Social Care Research Grants webinar. So if that's what you're expecting, you're in the right place. Just wanted to let you know that we are going to be recording this presentation. Also, my name's Rachel Corbett. I work with the Health and Care Research Wales team at the Essex Institute, managing the application process for this scheme. So, as I said, we'll be recording this webinar and making that link available to you as well as to anyone who wanted to attend but wasn't able to. And we're going to have some time for questions at different points during the webinar. So if you could put any questions you have in the chat, then we'll route during question time. We are limited on time, so if we don't get to your question, we'll be aiming to answer those in writing after the meeting. So I'd like to start by introducing Michael Bowdery, who is responsible for the oversight of the Health and Care Research Wales funding schemes, the research development infrastructure, UK partnership working, and cross-funder initiatives and budget. And he's going to be telling us about the future of social care in Wales.
Thank you very much,
welcome, Michael.
Thank you. Thanks, Rachel, and good afternoon, everyone. Yeah, I noticed the agenda has asked me to talk about the future of social care research in Wales and also the priority areas for the call. I guess it's easier to respond to the second of those than the first, but I will. But I will make some comments relating to social care research in Wales that hopefully will give some context to this call. The truth of the matter is I don't know what the future of social care research in Wales will look like, but there are some things that I do know. There's certainly a growing awareness of the importance of social care, and thus social care research, in providing robust evidence for policy development, for service delivery and organisation, for meeting public need, for example. And there's growing awareness of the need for health and social care service integration, and understanding, I guess, that social care is not a standalone entity, perhaps in the way that people have thought of it in the past. I also think there's a growing awareness of the importance of community interventions and work around prevention, helping people live fulfilling, supported lives without, or at least with less need for health and social care services. It's true to say that an increasing prominence has been given to social care research within Health and Care Research Wales thinking over the last 3, 4, 5 years, and that's led to tangible changes in the numbers of initiatives and funding opportunities we offer, though it's also led to an increasing awareness of the challenges that we face. I wanted to say something just about the activities and opportunities first, because there is quite a lot going on. We offer studentships, fellowships and project grants. We buy into and participate in a range of NIHR programs that increasingly are developing social care components. We now fund 2 research centres, CADA and the CASCADE Partnership, which have explicit social care research expertise, working to develop high quality research portfolios in relation to older people and children, respectively. We fund Exchange, a dissemination and engagement programme. We fund Deep, a co-production approach to knowledge mobilisation. We fund Enrich to enable more research to take place in care homes in Wales. And we're putting a lot of effort into generally extending the support provided by our research delivery infrastructure to the social care sector. The challenges, of which there are numerous, I guess for today's purposes are perhaps most easily summarised by one word, and that's capacity. We know that there is a social care research capacity problem in Wales, as in the rest of the UK, and it's a problem that must be addressed as the importance of social care is increasingly realised and research demand for social care research increases. So some of the schemes that I mentioned above are specifically working to address the issue of capacity. We're funding now a separate social care research capacity building initiative led by Donald Forrester. And the issue is reflected in the very remit of the current funding scheme and the call that we're here to talk about today. And if I can quote from our documentation, it says, this scheme aims to support capacity and capability building in social care research by funding high quality research projects with clear relevance to social care service users, carers, practitioners and policymakers. I don't want to say I won't make any more general comments for now, but to go on to prioritisation a bit more specifically, the first point I want to make is that this is a general call. Any topic is relevant and can be submitted as long as it complies with or fits with the What is Social Care Research briefing document that is included in the scheme documentation. However, we have also set out some areas in which we say we particularly welcome applications, and we've called these priority areas. By way of background, most of you will be aware that there is a social care research strategy in existence in Wales. It's a Social Care Wales document written with and endorsed by Health and Care Research Wales, and we work together with other partners to implement that strategy. One of the things the strategy does is give attention, focus or impetus to the idea of better social care research priority setting. And so we've long had a priority areas brief in our social care scheme. And the first of the priority areas for the current call is directly taken from that brief. It's children who are looked after and reducing the need for children to be in care. Partly as a response to the strategy, Health and Care Research Wales has recently developed a process for identifying priority research questions, which is to say questions which really matter to service providers, to practitioners, to those in receipt of services, people who care for those in receipt of services, for example. We call it a modified JLA process, though in reality it's both quicker and goes further than a JLA priority setting partnership. Now, the second priority that we've identified for this call is that of research questions or applications that address the research topics that emerged through the exercise that we ran last year. And that exercise was how can we best provide sustainable care and support to help older people live happier and more fulfilling lives. There are links in the documentation that give you some background information and give you a list of those research topics, and we even indicate the ones where we think people, the kind of people and the kind of questions that we usually see in this scheme could make a big difference. The third priority area is highly topical. It's equality, diversity and inclusion. I'm not sure it needs any further introduction at this point, given that the spotlight that the last 12 or 18 months have shone on it. I will say though that as a priority area, it was something that developed through discussion between Health and Care Research Wales and Social Care Wales, in particular discussions that we had with Lisa Trigg, who drafted the relevant section of the scheme documentation. So I think I'll stop there, but I'm very happy to take questions later in the Q&A session on anything that I've said, or indeed anything people want to ask that where they think I've missed something out. Thank you.
Thanks, Michael. Really appreciate that. So next we're going to be hearing from Dr. Clive Diaz. He is an experienced lecturer, social worker and researcher at CASCADE in Cardiff University, and he is the recipient of one of the social care grants. And so we've asked him to talk with you about why he applied for it, what benefits he's seen from it, and just the experience in general. So Clive, thank you very much for being with us today, especially on moving day.
Thank you very much. Can you see me? Can you hear me okay? Hopefully my slides will come up shortly. Yeah. Okay, so I'm just going to speak for sort of 10 minutes maximum, really. And if anyone's got any questions they want to ask at the end when I finish speaking, that's fine, or at the end of towards the end of the session, that's also fine. So if we go, if we go on to the next slide, so my experience, what I'm talking about today is I got a grant to look at the new child sexual exploitation guidance that came out in Wales. It came out later than expected, actually, April this year. It's originally due out about a year before that, but because of COVID-19 and the lockdown, etc., it was delayed somewhat. So, so I'm just closing that. So what I'm going to be talking about is my experience of undertaking that grant with HCRW, and also I'm going to just say a bit about my general advice, having applied for a couple of grants. This was the second grant I applied for. The first one I was successful, and I've just got some very general tips really, but I know Jonathan's going to go into more depth on those later on. So we go on to the next slide. I guess so. I'll just say something about my background. I did a professional doctorate at Cardiff University. I'm sort of very much from a practice background. I was a social worker for sort of 14 or 15 years, then came into academia and did a professional doctorate at Cardiff University, which I really enjoyed. But, you know, I paid for most of that out of my own money whilst practicing as a social worker and a social work manager. And it was very different carrying out research in that context to my current experience of carrying out research with Health and Care Research Wales. And if you apply for a grant, and you know, I'm going to be honest, it's a lot of work. It's a lot of work to get one. But if you get one and you're successful, it gives you you know, it's a fantastic opportunity. I can't minimize that. You know, whereas in the professional doctorate, I was paying for my tuition, which was excellent, paying, you know, doing it in my own time, weekends and evenings, etc., taking time off to do interviews and the fieldwork, etc. Obviously, you get paid for your own time to do the research. You know, you get your salary paid for. But you also are able to apply to get a research assistant for an appropriate amount of time. So I've got a research assistant 2 days a week on my project, and that's fantastic because it means there's an opportunity to work alongside someone who's got lots of experience and expertise, and is also able to help with some of the various different tasks that is involved in running a research project. And it also gives you time to look in real depth at a subject that you're really passionate about. You know, like we've already heard, you can apply on pretty much any subject as long as it's social care related. And so, you know, it does give you a great deal of opportunity to really look at a subject in depth that you're really passionate about and you think we need to know a lot about. And let's face it, in children's social care, as in adult care, it's an under-researched topic overall, and there's lots more we can find out about it. I think the other really exciting thing about it is it gives you the opportunity to work with experts in the field. So I've reached out to experts in the States and across the UK and get them involved. And of course, you can apply for bits of funding for them to be on, you know, on expert advisory boards, those sorts of things. It can also give you the opportunity, really importantly, to work with young people or with citizens or people who experience services. Again, I think that's so important. And of course, you part of the funding is that they're paid, and they're paid properly for their involvement in the study. So that's brilliant, and that's fascinating. I've also had the chance to speak and talk to policymakers, to social workers. And I've been, despite carrying out this study during the pandemic, I have to say people have really engaged well with the study and been really interested, from senior managers to policymakers in Welsh Government to academics across the world, really, but also social workers on the ground who are very busy. But because it's an interesting subject and they realise it's an important subject, I've found that they've been really, you know, really interested in it and being part of it and given their time to be part of it. So if we go on to the next slide. Yeah, I think that I can't say enough about what a fantastic opportunity it is for me. You know, I'm working alongside one of the main experts in the UK in terms of realist evaluations, Dr. Sarah Brand. So lots of methodological expertise. Professor Donald Forrester is in my research team and able to give me mentoring and extra support. So that's been fascinating and great to learn from him. I've got an excellent research assistant, Juan, who's working alongside me, and we meet, every week and talk and do some of the interviews together and do a lot of the field work and lots of discussions and thinking about papers and thinking about dissemination all the time. And then also, of course, like I've already said, speaking more widely to people across, expert academics across the world on the subject. So that's fantastic. In terms of flexibility, of course, it's essential you meet what you do what you say you're going to do, and the outcomes, the reports, and the papers are published. I'm trying to work on papers sort of throughout the study rather than just at the end, because I think I like writing papers. I think that's how I work out what's going on and learn more myself. So it's really important you meet that. But also, I've carried out a lot of evaluations and work for local authorities over the years, and you do get definitely more flexibility and more freedom when you're carrying out a grant for a funder like Health and Care Research Wales. And I've been struck by that. Of course, you need to do what you say you're going to do, but you do have more freedom and flexibility within how you do it. And that's been excellent. I've really enjoyed that experience. If we go on to the next slide. I'll say one last thing on the funding thing. Also, of course, you can put in funding around, typing things up, transcriptions, travel, all these things. Again, when I was doing my doctorate, having to do that myself, paying for my own travel, that's been a revelation, really. And of course, money to get open access papers published, that can be part of what you apply for. So it can be, it's just a totally different thing, really, to doing definitely a professional doctorate and probably to a normal PhD, really, as well. Just a few tips towards the end then of my bit on the application process. I've spent over the last 2-3 years writing a lot of research grants to be successful with them. And I remember very clearly the moment I got the email from Health and Care Research Wales saying that I got the grant. And it had been a long slog. I'd had to deal with peer feedback, deal with other feedback. There'd been some extra questions at the end there. So much work. The feeling of elation was quite. I can't tell you how over the moon I was. I couldn't believe it. Apart from anything else, it gave me funding to carry on working as a research associate at CASCADE for an extra couple of years, but also to do a fascinating study. It was brilliant. But the work that I put in alongside others to get this, also, we can't underestimate that. It takes a lot of work to get this. Much more difficult, I would say, than getting journal articles published, much more difficult than getting a book published, which I've had fortune to do both those things in recent years. So I would, you need to set aside time to get this right. It's not something that it's not like, writing a blog or even an article that you might be able to turn over relatively quickly. It really does take time to get it right. I think it's particularly important, and Jonathan may well say more about these points shortly, but particularly important to be clear that how your methodology is going to answer your research questions, because the applications will be peer reviewed by very experienced academics, and they're going to pick that up very quickly. And the first application I put in that wasn't successful, that was one of the big issues there with it. I think it's also very important to get the balance right between not being overly ambitious, but also saying that you're going to offer something of value. For me, I do research. I'm involved in research because I want to improve services for vulnerable children and young people and families. That's why I'm doing it. The grand scheme of things, the papers, the books, whatever, that's a part of the process you have to go through to be an academic. But I want to have an impact and improve services for vulnerable families. And I think, you have to be clear about how you're going to do that. There has to be clear impact and thinking about the impact. And I guess that links to my final point, which is around the importance of meaningful public involvement. Something I'm looking at for this current round of funding is working alongside a service user, someone who's experienced services as a joint PI, so that I'm really, doing it in depth, this working alongside members of the public, because, it can be done, and it's very obvious if it's not really done in a meaningful way. We want to avoid sort of tokenistic public involvement. We really need to do it at a genuine, deep level, where they're really working alongside us on these projects, helping to look at practice in depth and essentially, very importantly, how we can improve practice for them. And of course, people who've experienced services, They know best what it's like on a day-to-day basis. They know the things that go well and they know the difficulties. So getting them involved, young people, parents, I'm thinking of the child protection arena, people with mental health issues, if you're looking at mental health, that's so important to do. So that I'll finish on that. If anyone's got any questions, I'm more than happy to answer any questions now. But I would say, yeah, it's been an excellent experience for me. I cannot speak more too positively about it, and I would really recommend people put in applications.
Thanks so much, Clive. We've got 2 questions in the chat at the moment.
Yeah.
But they look to me like they are actually more about the process for applying. So one is asking, does it matter if the application comes from a university department other than health or social care, as some highly suitable applicants have ended up in unexpected departments through reorganization? So I'll take that one, and Jane, Jonathan, Michael, if you want to jump in and add to anything I say, please do. But as long as the project proposed meets the remit of the scheme through, that's outlined in the guidance notes, then the department that the individual belongs to doesn't actually matter very much. And then we have another question also from Anne about yeah.
Sorry, I know you did say jump in. Can I just add something to that last answer, which is absolutely right? But I think there's a point that also might reassure people, and that's, I mentioned capacity building in my early comments, and there's some recognition of the value of researchers and departments who perhaps have good skills but have not traditionally worked in the social care field, applying their skills in social care. So although in this case a social care researcher might find themselves in a department that isn't obviously a social care research department, I think assessors, funding boards and others are kind of primed for that, and are very open to welcoming applications that aren't on the face of it from places they might have come from before.
That's great. That's even more positive than I've said it. And then about the early career applicants, there's a question, can they build in time for an academic mentor into the application? And if you're an early career researcher applying to the scheme, then you're actually required to have a principal co-applicant, and that would be a more experienced researcher who would fill that mentoring role and support you through the process of applying for and completing that research. Just a quick check if we have any more questions from anyone. Nope. Okay, in that case, I'm going to move us on to Professor Jane Noyes, who's a professor in health and social services research and child health at Bangor University. And she's going to be telling us about what support is available for you as you're applying for these grants.
Great, thanks very much, and thanks for my slides, Tina. Hello, everybody. I'm going to pick up on some of the things that Clive has been talking about and pick up the threads of support that are available to help you submit a cutting-edge application. Next slide, please. So I think the first thing is the support from your organisation and partner organisations on your application. We've talked about this just now in our discussion. I think the key thing is to start early. You will need permissions from your host organisations to submit this grant. They will need to prepare a budget with you. So you need to make very early contact and make friends with the relevant people who's got to sign off in your organisation and in your finance department. So you need to make the right connections very early on. Share your developing research plan, get feedback from other research active people in your department to make sure that you're polishing your application as you go along. And certainly make sure that you talk to your line manager, because it is an organisational decision as to whether this application goes on, and your organisation will have legal responsibilities when accepting a grant. So make sure that you've got all your permissions up front. And good organisations can be very supportive of applications. Next slide, please. So Health and Care Research Wales themselves have an absolutely enormous amount of support. Why is this important? Well, the funding committee asks questions when applicants haven't accessed the support available, and submit an application that needs significant further development, because we always wonder on the panel, well, why didn't they do this to get the support to develop this further? So I've got the links in the slides here for you. So there is the Health and Care Research Wales Support and Delivery Service. Michael Bowdery has already said that one of the aims is to expand up the capacity and to build and open up the service to social care. There are eligibility criteria, but if you are in a social care organisation and you want support, please do put in an application and get the support. Even if you can't get one-to-one support, there are all sorts of modules available online, and I've put the pen pictures of the different modules there. So developing a research idea, identifying partners and collaborators, developing a protocol, finances and funding, setting up a research study, research agreements and contracts. It's all there for you just at the click of a button, and these are excellent resources. Next slide, please. In Wales, Health and Care Research Wales have also funded a series of infrastructure support centres, and Michael has already talked about some of them. He's talked about DEEP and a couple of the other sort of more socially care orientated ones. I'm going to pick out a couple. So Enworth, which you can see on the slide here, is a trial support unit. So if you were going to do anything about an intervention development, thinking of interventions in their broadest context, it could be an initiative, it could be a new policy implementation, that sort of thing, and you wanted advice, then Enworth as a trial support unit specialises in social care interventions, as does the trials unit in Cardiff. Any change in any service, often costs are really important to understand. Are you adding costs? Is it cheaper? Is it more cost effective? And the Health and Care Economics Cymru Support Centre have got people that can help you design an economic evaluation to add to your evaluation. Health and Care Research Wales funds the SAIL Data Bank. The SAIL data bank increasingly includes social care data, and Health and Care Research Wales are very keen on including the big data projects and analysis, and SAIL have people that can help you work up an application. Let's go on to the next slide. I'm going to point out a couple more. So here you can see right in the centre is the Centre for Population Health. I'm involved with this particular centre. Population health, we're particularly interested in social care as well, at the interface with population and public health and NHS care, or social care on its own. So we have research officers that if your question and topic fit and match with our remit, that we could potentially provide you with support to work up your research question and application. And you can see here some of the other infrastructure support that Michael has already mentioned. So there's a lot there. They've all got websites, so I just suggest that you have a look at the remit on their website to see whether your question and topic matches with their remit, and make some informal inquiries as to whether they might be in a position to provide you with some research support to develop your ideas. Next slide, please. So the Essex Institute, you've been talking to Rachel, who's chairing our webinar today. The Essex Institute manage the grant competition at the front end, and their support that they provide is really important, because you need to meet all the criteria to address all the remit and competitiveness things when submitting an application. So the Essex Institute manage the grant application process. They provide the support documentation, the guidance notes. They provide the more information on finance and the supporting roles in stage 2. There are guides how to use eGAS, which is the online portal for submitting your application, which again, every time you come to something new, it does take a lot longer to do it the first time. So they can provide support with submitting your application electronically, and there's a really good frequently asked question document. They provide ad hoc advice by telephone and email, and they're absolutely excellent at doing that. They provide bookable surgeries for applicants, and this is an absolute must. If you want to further develop your skills, or you're new to this, then book a surgery. This webinar is an example of the support that they give. And also when society opens up again, you'll see the Essex Institute has got a stand at the Health and Care Research Wales conference. You can go and say hello and meet people like Rachel, who's up front today, or Tina, who's organisational behind the scenes today. You can meet them in person. Next slide, please. You will also need to probably think about data protection, data sharing and GDPR. And that's the thinking about all the sort of regulations. So why is this important? You need to be aware of the issues around data controlling, sharing, processing data when submitting an application and conducting the study. The Research Design Service can provide advice on this as well, but in Wales we also have some great publications on how to do this. So any study that's going to involve personal data that might be shared between organisations would actually fall into the remit of the data protection and data sharing principles, so that you'd have to adhere to that. We'd want to be confident in your application that you understood data sharing and that you had built it time into your application to make sure that all the data sharing agreements were there, and also that you knew how to properly store data, and that therefore if you were awarded a grant that you'd be a safe pair of hands to handle people's publicly or personal data. Next slide, please. Now, Clive mentioned patient and public involvement. In social care, it's much more likely to be client and public involvement in your application. Why is this important? Well, adequate and adequately funded PPI input is absolutely essential for every application. You won't get funded if you don't have it. It will be seen as an essential gap. There are UK standards for public involvement that we look to see that your application is meeting, and that you can find the documents online. The Research Design Service can provide you help and support with this, and there's a whole section on the Health and Care Research website about integrating good PPI into your research proposal, getting the right people, building in activities for the PPIs to do that isn't tokenistic, that it's actually more towards the co-production side of things than just consulting. It is actually proper patient and public involvement, and that you understand the differences between patient and public involvement, engagement and stakeholders. They're all completely different things. So you need to look at the guidance and make sure that you've actually handled this appropriately. There are PPI members of the funding panel. They explicitly hone into this in the application. They love seeing strong PPI with an appropriate budget, and they'll pick up any deficiencies that need addressing. Next slide, please. Support with ethics and regulatory approvals. Why is this important? Well, you need to build an awareness of the process and sufficient time into the research timetable to gain the relevant permissions. There is the UK Policy Framework for Health and Social Care Research. You'll find guidance on the Health Research Authority website. NHS ethics committees will look at social care studies with vulnerable participants if there are particular issues, and we've talked already about studies of children, looked after children or those vulnerable or in need of protection. Those, the NHS committees will look at those. In England, there are social care research ethics committees. We don't have the same structure in Wales yet, but the England social care ethics committees will look at Wales studies if there is one or more sites based in England. So that could be really helpful. You'll also have probably institutional requirements to meet. Many organisations have internal committees, review boards and governance processes that you have to meet. What we like to see in the application is that all of these issues have been flagged, that there's sufficient time in the research plan to achieve all these things, and that you've given a really strong indication that you're aware of all the research governance issues in both developing the application and delivering the study. Next slide, please. Support with intellectual property and commercialisation. We see many studies that produce outputs that are products, and that product could be anything from a tool to something new that's developed that actually might be have an opportunity for commercialisation. The Research Design Service can advise. Why is this important? Well, there are sections on the application that deal with intellectual property that you need to address so that you don't miss out on opportunities. And the applications are looked at by Health and Care Research Wales to see if there are any IP things that need addressing. And I've put some links in there for some of the support that's available to help you do this. Again, your organisations may also have people that you can speak to about intellectual property. Next slide, please. Support with research support costs if undertaking social care research at the interface with the NHS and involving NHS patients with social care issues. So we do see some applications that are firmly in the remit of social care, but they're integrated with patients that actually are recruited through the NHS, or there might be an integrated care model going on where patients are have both health needs, but the element of evaluation is through looking at the social care components here. That means if there are costs to the NHS, such as recruitment costs, or you're asking for some clinician time to recruit, or etc., there's a separate budget that you'd need to complete. We have separate specific guides in Wales, which I've put the links in the boxes there, but there's also some UK-wide guidance, the Accord guidance, and there's an Annex A which applies to the UK, and also Annex B I think applies to the UK, so that you can have a look and see what might be appropriate for your application. And again, we can provide extra advice on this if you're unsure. That's something to take back to the Essex Institute or to bring up in one of the surgeries or webinars. Next slide, please. So in summary, I think that there's a huge amount of support available to help you develop a cutting edge application. Please use it to further strengthen your application and to avoid all the common issues, and to actually make sure that you have the top tips that Jonathan will go through in the subsequent presentation. So thank you for listening. I have to say that as one of the panel chairs and deputy chairs, when we see a really high quality application come through, it's absolutely fantastic. We can't believe how good it is, and I think generally over the last 5 to 10 years we've seen the quality of the applications increase dramatically in the social care sector, but there's still room for further improvement. So thank you for listening. I'm happy to take any questions either now or at the end, and Jonathan's going to talk to you next.
So we have a couple of questions in the chat, but they're both more general rather than to do with your presentation, Jane. So I'll take those at the end, if that's okay with everyone, and we'll move on now to top tips for applicants. Professor Jonathan Scourfield is going to be telling us about that. He's Professor of Social Work and Deputy Director of CASCADE, the Children's Social Care Research and Development Centre at Cardiff University.
Thanks, Rachel, and thanks, Jane. It's all very helpful. So I'm here really as the chair of the scientific panel, which advises on the awarding of the grants. So I'm going to talk a bit from my experience as chair of that panel about seeing applications come through over a number of years. So top tips and also some pitfalls to avoid along the way. So it's very old school, no slides. I'm going to make 5 points. Okay, so point number 1 sounds like a really obvious one, but it is worth repeating, which is this is the importance of the methods and the design fitting the research question. Now, the funding panel does not operate a hierarchy of evidence in the sense that we really want to fund some types of studies over others. However, we are looking for horses for courses. We're looking for the right kind of methods for the right kinds of questions. So apologies, this is fairly obvious stuff, but it's surprising how people sometimes get a bit caught out. So, if you're looking to, your research questions are about lived experience, you're very likely to need some very highly qualitative methods of inquiry that allow people with lived experience to express that experience in their own terms. If, however, you're looking to study to measure the outcomes of an intervention, then you're very likely going to need to compare it to not having that intervention, which involves some kind of comparative study and certainly some form of measurement, some form of quantification in that quasi-experimental or experimental design. Second point, the importance of social care sector involvement. I think others have also alluded to this in the previous talks. But there's a whole range of different kinds of involvement you can have. It's quite legitimate in some cases for research questions to flow from a review of the academic literature primarily. That's a perfectly legitimate thing to do. In other cases, research questions will very much emerge from the field of practice. But in any of these different scenarios or different levels of sector involvement, you need to be very clear that you are at the very least talking to and have on board social care organisations. So what I think the panel doesn't want to see is something which is just exclusively driven by academic interests and no conversations have been had with anybody who provides a social care service. That leads in really to my third point, which is about getting the best team. Now, this very much links to some of what Jane was telling you about the infrastructure for research that's already out there in Wales. It's really important that you get the best combination of people to support you in your application. Don't just think it has to be people in your small unit that you already work in, your existing immediate colleagues. Of course, it can involve those people, but do also think more broadly. And I think it is important here as well to think about social care expertise, because we absolutely welcome people applying from fields that where they haven't traditionally focused on social care questions. Michael mentioned this earlier, and I absolutely agree. It's really important for capacity building to get people in other disciplines showing an interest in studying with robust methods social care topics. That's really, really important. What perhaps doesn't work so well is if people coming in with no background in social care who have not involved anybody with a background in social care in the application. My advice would be, if you are coming in rather from outside of this topic, well, you talk to some people who already do social care research. All the universities of Wales have such people. Talk to them, involve them in your studies. Fourthly, the importance of public involvement. Now, certainly Jane mentioned this, and I'm just reiterating what she said, really, because the panel really is all over this. You know, applications with weak public involvement will be spotted and criticised. And it's important to make sure, as Clive also said, it's very meaningful. So, you know, doing some qualitative research with service users is not public involvement. That's research. You know, however, involving some people with lived experience of services in steering the project, in advising on the project, could be possibly in helping to conceive of the project in the first place, or even collecting data. That's public involvement. Just doing some qualitative research with people is not. Neither is talking to professionals in the social care sector public involvement. You know, when we talk about public involvement in social care, what we really mean is the voice of service users and carers. As others have said, make sure it's properly costed and there's proper time allowed to do it properly. And then my fifth and final point is about research, the application of research insights and research findings. Again, there's a range of different levels of application we see in proposals, and we're not insisting on any one type. The outcomes of projects will vary a lot, from something which is very practically and immediately useful up to something which is much more, I suppose, agenda setting for future studies. But we do want to hear about what the application is, and we want people to pitch it appropriately. So don't overclaim, but equally don't undersell the importance of the application that will flow from your study. Don't confuse dissemination with application. You know, just presenting findings to some practitioners is not in itself application or the use of research. It's just telling people about it. So just be clear to distinguish what you mean, pitch it appropriately in terms of the level of application for practice, that is practice or policy or future research that is accurately fitting with the project that you're proposing. Okay, I think that's all from me. Thank you. About tips and pitfalls.
Thanks, Jonathan. One of the questions that was submitted previously actually goes along quite well with what you were saying about the team. So the question from Sarah Wallace is, can the principal co-applicant involvement extend beyond mentoring, e.g. supporting / co-leading a work package?
Shall I respond on that, Rachel? Yeah, yes, is the answer, I think. Simple as that.
Yeah. And then here's another one for you, which is from Anne Collis. So transdisciplinary teams would be welcomed if it allowed a new perspective on wicked issues.
Sorry, let me just look at that question from Anne there. So, yeah. Transdisciplinary teams would be absolutely welcomed in any cases where the transdisciplinary nature was helpful. And so, yes, if it allowed a new perspective, but there will be lots of projects where you may need a transdisciplinary perspective. Depends on what you're proposing. But, you know, there's very many of the applications we see coming through would benefit from some disciplinary input, I think is true to say.
Thanks, Jonathan. So this other question's from Anne Crayer. So I know there have been some workshops on SOCAT previously. Are we planning on running any more? So we're not actually the ones who've run those workshops, and I'm not sure if they are planning to run anymore. However, if you take a look at the guidance notes for the call, there are a couple of email addresses of individuals who'd be able to provide advice and support on the SOCAT. I'm just going to hang on here for a couple more minutes. If anyone else has any questions, could you please put it in the chat? In the meantime, while we're waiting for any more questions, I just want to say that the deadline for this call is 21st of October, and that may seem like it's a really short time. However, this first stage of the application process is focused on the importance of the question. So you then have additional time if your application was shortlisted to dig into some of the more detailed parts, the methodology that you're planning to use in detail to further build your team if you need to, things like that. This first part is looking at whether it's in remit for the scheme and competitive, so if you have a reasonable chance of getting funded, and whether you've got the importance of the question. So the All Wales Prioritisation Panel look at the importance, and that list is ranked, and then a certain number of those are shortlisted. And you're asking if we need institutional permissions before stage 1. I think maybe Jane, would you be able to help answer that question?
Yeah, you'll have to check with your own organisation. I mean, I work in a university and we can't submit anything unless we've actually got organisational permissions to do so. So check with your line manager.
Yeah, it's not a requirement from our end, but your institution's policy may vary. Is there anything else that you, Michael, or Jane or Jonathan would like to add?
I think I would just say, you know, plan carefully. You know, when putting these applications together, you will need regular team meetings to discuss ideas. You will need time with your patient or client participants to make sure that you're building in their ideas and they've got sufficient time to have a look at things that you're producing and comment on them. it takes a lot of work to work up a research application, but you know, the building blocks that we're sharing with you is time worth investing doing. We see lots of applications that seem semi-finished or you know, not quite there, and we can provide feedback to further strengthen them, but it would be much better if you could get a stronger application in at the outset. It would save you a lot of time in the long run, and it's not nice. I always think in research you get used to rejection, but there's a lot of things that you can do to minimize the rejection, and so hopefully you'll take on board lots of the things that we've shared with you, the practical hints and tips.
Yes, and as Tina's just put into the chat, we do have some bookable sessions with our subject advisor here at the Essex Institute, who would be happy to talk you through some of your ideas, maybe help you develop it, check that it is in remit for the scheme, that sort of thing. So if you are interested in booking one of those sessions, please do email us. Anne Crayer is asking if we can say a bit more about the funding pot size and how many projects we're expecting to fund. Michael, can I leave you to do that one?
Yeah, sure. So we have a pot of around 1.5 million available for this call. I think this time, as last time, we've also introduced the idea of funding bands, and we've asked people to say which band their project falls into. We're not setting a top limit for projects. We expect to fund probably between 4 and 8, but that does depend on the cost of the applications, obviously, that make it to the funding board and then are assessed as being you know, high quality projects. I would just add that we do encourage a range of applications in terms of size and, you know, length and cost. That there's been I guess the feeling we've had in the past is that if you set a limit, people always push at the limit, and perhaps people have been reluctant to put in for smaller awards. There's somehow a feeling that the project isn't as good if it's a smaller project, but that's not the way we see it. We're more interested in the question and the answer and the quality than we are the cost and the duration.
Thanks, Michael. All right, well, in that case, if there aren't any more questions, I'd say thank you very much for joining us for this webinar. We really hope to see applications from you in the future. Do get in touch if there's anything we can help you with, and we hope to interact with you further in the future. Bye.
Thanks, everyone. Bye.